a brief overview. My article is, like you said, an open access article. It is titled, let me get the exact title for you guys, and just search it. It's called Surgical Management of Idiopathic Ulcerative Calcinosis Cutis in the Lower Extremity. And this is a case report. So like I said, case reports are one of the, lower tier of evidence, but it's definitely not an opinionated article. It has some level of evidence with it. There's the 5 tiers of evidence-based medicine. When you have your, editorials or opinion-based research opinions, which is your level 5. Then your level 4 is case reports and case series. Then you have your case control studies as a level 3. Then you have your cohort studies as a level 2. Then you have those randomized controls trials, often referred to as RCTs. Everybody kind of says that. They don't really say the whole word anymore. And that's your highest level of evidence. So this particular paper is a level 4 evidence, which isn't too bad, but it's just something I wanted as a lead off in this particular series with PodMed Adventures. I think this has been a great article. And I'm sure you guys will get some guys that have some, crazy RCT studies in it. And I could recommend some good researchers that I know that do some of that stuff.
Yeah.
So in this particular article, like I said, it's in the Journal of Foot and Ankle Surgery. Basically, it was a case that I encountered my second year, end of my first year, beginning of my second year of residency. And one night, actually, I was on call working with another attending. We were doing a gas gangrene case, and we're done. It's like midnight. We both go down to the ED just, because we're trying to leave the place after we've done the OR, after being in there for 2 hours. And emergency medicine doctor yells, Dr. Johnson, Dr. Johnson. I'm like, oh boy. And the attendant just looked at me like, I'm out, guy. Like, you're on call. I'm not on call. We just so happened to do that case that night. So she skedaddled. And next thing you know, I meet this lovely, Hispanic American female, about almost 80 years old. She speaks a little bit of English, but enough to get a history out of her. She has this, crazy ulcer in her leg, and I'm looking at, at her, and she has crazy raging cellulitis and pain. I'm like, okay, just, another diabetic, workup. And then I actually speak to her, and she's like, I'm not diabetic. She goes, actually, this happened to me when I was 19 years old. And I'm like, how old are you? She's like, at that time, she was like 76.
Yeah, I didn't see that. I just, I saw that.
I didn't put that in the, I didn't put that in the case. I didn't put it, but yeah, she was like, this is you guys get the behind the scenes of what's going on. So I was like, oh, okay. So she's like, oh, at 19, but she goes, I think she was somewhere in South America. She's like, but back then, the doctor did, he did his thing and he healed it. And I was like, okay. But she goes, now it's back and it's, it's raging. So every time you work up any podiatric case or usually orthopedic case, you always start off with x-rays, especially when it's infection, because you want to make sure there isn't a gas gangrene, which is a necrotizing infection. For people who don't know, it's basically almost like a flesh-eating infection. That's how you get those flesh-eating infections. So most times in ER, you get an x-ray. So we get an x-ray and we look at this lady's legs, and there's calcium deposits all over her legs, like plates of calcium. And this is why she's ulcerating, which is called ulcerative calcinosis cutis. And at the time, I was like, okay, this is going to be an interesting one. So I called the attendant on call. I said, tomorrow we got to take this lady to surgery, clean out this wound. He's like, all right, no problem. So, fast forward to the next day, we do the case. I'm like, oh, this, straightforward case. I just cut out the wound, this should be fine. Go straight down to, to bone. And I was like, oh, just, down the bone. And so we close up, do everything, do our little care. So we do another x-rays, and that bone was actually still the calcium deposit that was in the lady's leg. It was not bone, yeah. So, yeah, that gets into it in the case where you kind of see we do a second procedure. And we was like, oh, man, we didn't even, we just hit the surface. So we get in there, and it's like almost like plates and like pallets of calcium deposits.
Yeah, I was reading in the second surgery, you're talking about how you felt it, and it felt, really sharp. And I was sitting there thinking, I was like, man, you can only imagine, if it feels rough and sharp to you, like in your hand, what it must feel for the patient, on a day-to-day walking and just carrying on their day-to-day life.
Exactly. So we finally got all that out. We ended up doing a skin graft on her. And that gets, like I said, into the case. I don't want to kind of take all the fun out of it.
You gotta read it to see it.
Yeah, especially since this one's free. They can't, they can't say too much. Still, without skipping through it. And then, we put an acellular derma matrix, which is basically donated, cadaveric tissue that this company, cleans from patients that are fresh harvested, from their time of death. So it's basically, instead of harvesting, typically, podiatrists or plastic surgeon, we can harvest from the thigh for a split thickness. This skin is already prepared and you purchase it from that company. And that way you don't have to, harvest it from this patient, especially for a patient that's elderly like this patient. You don't really want to mess with creating another wound, even though it's a superficial wound, basically almost like a burn, to try to heal another wound that she's experiencing. And we ended up putting that on, and she kind of healed uneventfully. And oddly enough, which is interesting, right? Well, I had already written that article. I ran across her again. As you can see, there's at the end of the article, there's an 18-month follow-up. I ran across her again because the other side actually had, created the same type of situation. Just wasn't as crazy. And we actually didn't have to take her to surgery, so that's why I didn't even bother, creating another case report on that. But back to the, research and why a case report, especially as a, podiatric physician, I was, very young then. And that before you write any case report, most times you need to have a solid follow-up. So I had to have something that was like a year out before I could even write it up. But it was, something to kind of get my palate wet to researching and getting evidence-based medicine. So I had to read, a substantial amount of introductory articles to try to get people to understand what the topic was. What is calcinosis? The 4 types of calcinosis, Cutis, which is in the article as well. I want to, also have some educational points in there for the person that's reading it. And you guys will read about that as well. I don't want to kind of steal
it's really
but I'm
great.
Sure you probably learned a couple of things.
Oh, yeah. Yeah, I really liked it. Yeah, because, when I was talking to you previously before we started recording today, I was telling you that it's got such a really good flow. And I think for anybody that is just getting started with like learning about research, or how is research done, or, how do you create like a flow to start putting down your thoughts onto paper. Dr. Johnson's paper is really good because it helps you see a full, complete thought process from beginning to end. So I thought this was a really good paper.
Yeah, exactly. So that was, like I said, that's why, when you guys reached out, I decided to use that article just so we could kind of, you guys will definitely get other researchers in there that are doing some crazy stuff. I mean, I have other projects that I'm doing right now that we could talk about it. I have one major, pretty well-funded study that we're doing, a double-blinded placebo versus treatment study that we're doing for antifungal medication. I don't know if I can release the name of the company, but it's basically a company that that's a company that I don't know if I can release it yet, but basically a company that's created a antifungal topical medication that hopefully can be over the counter once we complete the study. And right now it's available to some providers, exclusively to providers at the moment. But right now we're doing a double-blinded, multi-center study. Multi-center meaning not even at our site. We're just the site, the principal investigators. So we're the ones that manage the study. We're not even seeing any of those patients. All of these sites are across the nation, about 6 sites from the West Coast to the East Coast. And so we're doing that right now, and that should be done in about give it about a year. So we'll write it up so it'll be done about 18 months. You guys will see the paper on whatever data that we decide that we get from there. So
go ahead.
No, that was it.
So speaking of, you're talking about another project that you're doing. How many projects typically are you working on at one time, or are you working on one project and talking about multiple others, or do you get multiple things going at the same time? How does that work if somebody's interested in getting into research?
Yeah, so definitely, when I was a resident, obviously it's a little bit harder to do those things, which is why I decided to do a clinical research fellowship. So most of people, I don't know, to make sure our audience know what fellowship is the training that you do after your residency in a certain specialty. You don't necessarily have to only specialize in that, but it's something that you're interested in and it sparks that interest when you do it. So we have in podiatry, we have sports medicine, we have clinical research fellowships, wound care, which is also a part of my fellowship. Wound care is like one of my main interests. Then you also have surgical, your surgical fellowships like reconstruction or pediatric fellowships. So mine is a clinical research. So I have dedicated time to execute those projects, which makes it easier for me to do it. But yeah, you do. I kind of keep things in a pipeline. I mean, I have about 5 projects that I'm working on right now.
Oh, wow.
And you kind of keep things going because, you never know. I mean, one of the reasons you have to, because even with the COVID-19, I had a big public health study that I was doing at geriatric facilities. It's a study that I'll still execute at some point. But the study is looking at geriatric falls and how it correlates to patients' foot deformities. So looking at bunions and hammer toes, the plantar fasciitis, the weakness of the equinus, which is decreased ankle dorsiflexion for those that the audience out there. And basically, if you notice, there's studies out there, especially in Europe. Those patients that have those foot deformities are, a certain amount of, increased fold or fall, at least 2 to 3 times falling just from having those, so predispositions. So I was looking to see how that correlated into the nursing homes. But right when I was getting ready to start my, my project, I had everything going with the, nursing home director, because I had a geriatric fellowship that was going to help me do some of this work as well, and that's what happened. So. So I had to postpone it because of COVID-19. Hold on one second.
Yeah, go ahead.
Yeah, back to what I said. So when it comes to, I was basically doing that study for the geriatric population, but I had to postpone that from there. So when you go back to your question is, yes, luckily I have a mentor, who is my research director of the program. And he kind of guides me on how to do certain ideas, how to execute the statistics on it, so I can kind of keep things going. He has a background in it. He has a master's in clinical epidemiology, which helps as well.
So that's a really good point that you bring up about a mentor, because I think that's what's really important. First step is if you're an undergrad or if you are in podiatry school now. One of the first steps, because I've done a little research myself, and I didn't know how to get started, and the first thing that I did was search out a mentor. And so I think that's really important that you bring that up, because that's really the important first step, is to find somebody who's doing research, approach them, ask them what projects they're working on, and find multiple people that are doing, research. And it's okay if you find somebody who's doing research that you're not interested, right?
Right, I agree. Yeah. So so the funny thing is, I had, like I told you guys, I started doing research when I was an undergrad, and I was like, I'm not gonna be a PhD guy when I'm a doctor. I'm a physician. I'm not just gonna, I'm just gonna do surgery, treat my patients. And then I get to residency, and my director finds out I know how to do research. She's like, you can get places with this. You can travel overseas. And I didn't even mention to you guys, I got numerous grants opportunities when I was a resident. It was awesome. So I got to go to Las Vegas, to go present research, those things that come with it. It's because people, especially when it comes to podiatry, people want to know what you're doing. And it's not just podiatrists, it's the MD cohorts and the DO cohorts. They want to know how to do it, especially wound care NPs, all those practitioners want to know how to treat their patients. Yeah. And podiatrists see things that a lot of people don't see. And then the thing is, you need to have that reported, which is why something like like a case report, it's introductory level, evidence-based medicine. It definitely, it's a good way to introduce yourself to it. So
I think that's a really important point that you bring up, because I think it answers like a really important question is how do our colleagues in different fields or whatever really get to know us and how our field is evolving and how we're changing and how really important we are as part of that core team. And I think you touch on a really important point that through research we can really showcase our depth and breadth of who we are and how important we are of that core team.
Yeah, exactly. So, and it's just like any other thing that you're doing. It's like a sport. The more you do it, the better you get. So, this is one of my first papers. I have other papers out there that, are better than that. And it's like a routine thing. But now, you get that, you become an expert at something. We're experts at the foot and ankle. And when it comes to wound care, we know that stuff. But to get people to understand that, you have to, publish quality research, good journals, and also do, talks on it. And that's exactly what it's all about. And, you have some of my friends that, they're actually in medicine, and they end up reading one of my papers like, I didn't even know you guys did that. And it's like, they kind of, it helps with the notoriety, the respect, and it also helps, and also for the patients. I mean, even this particular paper here that we discussed today, you know, a patient could probably even get through that, you know, just with a high school level education, you know, because it's not that technical of a paper, which is why I chose it as well. But that's the main thing. It's I mean, if you really want, you have to have research, and especially if you're gonna if you want to talk about, even from a practice management standpoint, all of our billing and our CPT codes and our ICD codes, which is how we identify diagnosis. CPT codes is how we, bill for the procedures that we perform, procedures that we perform, and that's how we do it. So, but it's based on those clinical research papers that they publish.
Wow, that's great. That's really great information.
That's not just for podiatry. I mean, that's how they find out the standard of care for certain, procedures that are performed. Yeah. So if you for example, if you say, just hypothetically, every bunion needs surgery, but then there's studies that show that bunions can do fine without surgery. That's why, likelihood of insurance may not pay for a bunion surgery, because they're like, we have all these studies that that show that we don't even need to do surgery. Why should we pay for this case?
Yeah.
And that's what you need. Obviously, that every bunion, some bunions need surgery, but not every one of them.
That's just really great. Yeah. Oh, well. Example. Thank you, Dr. Johnson, for coming in to talk about your research and talking about why research is so important. Do you have any final thoughts that you would like to kind of impart? Any final words of wisdom when it comes to getting started in the world of research?
Yeah, so as far as research, like I said, start off sort of how you mentioned, just reach out to anybody that kind of understands how to do it. Whether it's a project you don't have to be in love with it, but that's how you gain the skill to execute, on the subject that you are in love with. Just like, I love soft tissue stuff, but some of my friends, they despise it. They'd rather just, do some orthopedic papers or something like that, which is cool, And I do that stuff as well, but, so that's how it is. It doesn't necessarily have to match like lovers. You just have to, it's not a commitment like that. But you want to, get someone that's skilled enough to, guide you into how to do proper research and solid quality research. Because one thing I learned too with being in academia is you can literally probably get anything published if you have the right connections or the right it's people know about it now, but it's just kind of how it is. So you also have to make sure it's someone that's reliable and has a reputation. But as far as just advice in general, no matter what you're doing, if you're deciding just interested in podiatry or looking into podiatry or interested in another field, definitely always reach out to someone that does what you're, either have that slight interest in, and reach out to them, either speak to them or shadow them or, read one of their papers or anything like that. And you never know what happened. I mean, if you would have told me when I started, what year are you in podiatry school again? Starting
my third year.
Yeah, so if you would have told me third year, I'm going to be a clinical research fellow at Penn Medicine, I probably wouldn't have laughed, but I would have been like, okay, whatever. Well, you never know, what that journey is like. Keep an open mind and enjoy it. It's fun. I missed third year, I missed fourth year, I missed them all. It's fun.
Nice.
It goes by fast.
Well, you heard it here first, guys. You never know where you're going to end up or what you're going to end up doing. So PodMed Adventures will go ahead and, so again, the research article that Dr. Johnson published is open access, so that means that you can find it pretty much on your basic Google search, but we'll also are going to post it on our link tree so that you can get it easily from our page, so that it's open access and everything. I believe there's contact information in case somebody has any questions or anything. The lead author for the paper, and I believe is your information on there too, or?
Yeah.
Okay. Yeah, so typically, just to let you guys know, typically when you see a research paper, if you have further questions, there's what's called a lead author and a responding author, and emails will be posted there, and that's where you can email them if you have questions or anything like that. But other than that, thank you again, Dr. Johnson, for being our first inaugural research presenter, and we hope to have more people on and talking about more research so that you guys can really get your feet wet in learning all about research and what it takes to get it all done. So, all right, thanks guys.
All right, take care.